Hey everyone, this is Shelly, one of the dental hygienists who runs Hygiene Edge, and I wanted to show you today the triple brush. It has a buccal and lingual side of the toothbrush, which is angled at a 45-degree angle, and it also has an occlusal brush as well. And there's three settings on this. There's an H and an S and an M. And what that means, the first one that is H is kind of a little bit more of a heavier pulse, and an S is a softer pulse, and then the M is like a pulsation, so it's just kind of going off and on. You can kind of hear it going. And it has a 2-minute timer, and every 30 seconds it will tell the patient to move to the next quadrant. And it also of course has interchangeable heads, so you can get new heads as needed, and these bristles are about a medium to soft texture. So if I had a patient today that was using this, I would tell them that they have to also as well do a manual stroke with this. They cannot just rely only on the vibrations to clean their teeth as they glide it forward. They're actually going to have to do a little bit of a stroke to remove the biofilm. So I tested this by doing a biofilm index, and as you can see in some of these images here of befores and afters, that if you just use the vibration only, you're not going to remove all the biofilm. So if you're, like I said, if you're going to have a patient that's using this, you're going to need to make sure you tell them that you are going to have to do a little bit of a manual stroke with that toothbrush as well, because just the vibrations only are not going to remove all of the biofilm. Another important thing to tell the patient is that they need to make sure that they push the toothbrush all the way down on the teeth, and so that it will access the margin, because if they're just kind of getting the top, they're not accessing the gum line, which will then, you know, as we know, that's where the most caries is. This would be a really great toothbrush as well for medically compromised patients where they're having a caregiver having to help them brush their teeth, because it's quick and easy, has a long handle, it's thick so that the patient could potentially grab it if they have some dexterity issues as well. So I'm always an advocate if a patient likes a toothbrush and they're going to brush, to use it, but it's important for us as hygienists to make sure that we know what products are out there, so that if they are using it, we can make sure we give education on how to properly use it. So I hope that helps you learn a little bit of information about the triple brush.